Well, summertime in Florida means more hot, unbearable days. We're already feeling it, even though summer is still weeks away, which raises the risk of heat stroke. So here to talk more about heat stroke and how you can prevent it from happening to you or a loved one is Dr. Jaime Snarski. Thank you so much for joining us. Dr. Snarski is an ER physician for Palm Beach Gardens Medical Center. So, doctor, what is heat stroke exactly and how does it happen?
Heat stroke is on the spectrum of heat-related illnesses, from heat exhaustion, heat syncope, and then heat stroke being the worst, when your body temperature is above 104 degrees and you lose the inability to sweat, become dehydrated, and then have a neurological symptom associated with it, like confusion or altered mental status.
So what are some of the signs? I know you said some confusion, signs and symptoms of heat stroke. What other signs should you be looking for?
So your heart will be racing. Initially, you'll be sweating, and then you lose the ability to sweat. You can have nausea, vomiting, dizziness, the confusion. Ultimately, this can lead to seizures, coma, and death. And this is a true medical emergency. So you need to get to the hospital right away. So if there's anyone that you think has heat stroke, you need to get them into a cooled area, out of the sun, and call 911 immediately. I know people right now are afraid to go to the hospital, think that they might catch COVID, but we really have it very safe right now. We have pathways set up to keep patients and any visitors in the hospital away from COVID patients. So for all emergencies, you need to go in.
Yeah, I think that's a very important message these days, to not be afraid to go to the ER in the case of an emergency. Who are we talking about who's more susceptible to getting heat stroke?
Certainly the elderly are more susceptible, kids under 5, anyone who's disabled or has an underlying medical condition like heart disease, lung disease, kidney disease, and believe it or not, athletes. So anybody who's in the heat for too long and it doesn't stay hydrated enough, we see this a lot in athletes, especially during these summer months.
You talked about staying hydrated, but what other ways can you avoid getting heat stroke? What are some other tips you have for our viewers?
So stay out of the sun, of course. You want to limit your heat exposure, especially, like I said, if you're elderly or have underlying medical conditions. And most of the country, we say the peak hours of the sun between 10 and 2. But remember, Florida, it's so much hotter here. It's so much more humid, and we really have that heat all day. So if you are going to be doing activities outside, it's best to do that early in the morning or late at night. Also to wear lightweight, light-colored, loose-fitting clothing, wear a hat, wear sunscreen, and like we said, stay hydrated, because that's the most important.
A lot of good information there, a lot of good tips to make sure you stay safe. Thank you so much, Dr. Snarski. And it is hot. It's very hot outside.